Hi everyone, this is your interviewer Farah and I have here with me Mr. Amr El-Neklawy. Welcome. Can you please introduce yourself and your organization?
Yeah, absolutely. So my name is Amr El-Neklawy. I'm currently the Senior Vice President for Middle East North Africa for Emcure Pharmaceuticals. So Emcure Pharmaceuticals is a global pharmaceuticals company. Its head office is in India, and we have several inorganic acquisitions around the world accessing medicines. Yeah.
Sounds incredible. So nice to meet you, sir. Can you please tell us about how it feels to receive such recognition? Congratulations, of course.
Yeah, I mean, it feels wonderful, obviously, after a journey of, 25 years and continuing, hopefully. It's been really quite a journey, and it's very nice, and to receive the award is tremendous. Obviously, it's an individual award. I mean, there's a lot of people that are behind the scenes to, create whatever successes that's been done over the years. So a lot of peers, a lot of colleagues, building teams, so I'd like to thank everyone. And also the support and the positivity and the energy that you get from your family, because we do spend a lot of time in our business. So it's been tremendous, and it's really lovely.
Well, a round of applause to you and to everyone behind you. What would you say are your group's biggest achievements?
I mean, we're in the pharmaceuticals industry. I mean, we over the years since the founder, Mr. Satish Mehta, or more than 35 years ago, he's developed a conglomerate over in India. We're within the top 12 companies in India in the domestic market. We have more than 4 development centers, 14 manufacturing sites, more than 350 brands across the world, with a lot of different inorganic acquisitions, for different corporations in Europe, in North America, in the US. So, that's an achievement in itself over the span of years, and we're trying to build on top of that for the emerging markets in the region that I am holding for Middle East and North Africa. Now, we cater for really, it's been a journey, and it's been wonderful here in the conference in 2.0, because you see people talking about prevention, right? And we're not in the prevention game, but we come later down the line in terms of the therapeutics, because unfortunately people do get ill. I mean, it's tremendous that people want to be more conscious, to be living a healthier life, but when people do get ill, we provide solutions for that for the healthcare providers, right? So, and we work with a lot of policymakers, with a lot of HCPs, and also engaging patients on a number of different levels, depending, obviously. So, what we try to do is to access high quality medicines cost effectively, because access has become really, really important, and to cater for a wider pool of patients. And what's been really interesting, that post-COVID as well, securing the availability of medicine, that's become really, really important. And, this is what we're in. We cater for that. One key achievement that I'd like to really highlight for our industry and our, Emcure Pharmaceuticals, is that we're the first indigenously manufactured COVID-19 mRNA COVID-19 vaccine. So, and that's our own technology, and this is, it's a fantastic research platform, and we've developed it, and it's commercially available. The key interesting part about our mRNA COVID vaccine is that it's stable at 2 to 8. And it's been really, really difficult for a lot of countries who do not have the supply chain availability to be able to maintain such low temperatures of the COVID vaccine for a wider set of people. So with the 2 to 8 kind of storage conditions that we have, hopefully we'll be able to reach more and more people and patients. The interesting part about the research is that it was developed later on. So the strains that we use were more sort of Omicron specific. So we're working now to develop a one-shot Omicron flu vaccine. And there's a lot of international debates and continuing discussions about, do we need like an annual flu shot that's more specific for that, for people to travel, for people to be safe? Do we need to have a fresh vaccine all the time, for people to be vaccinated and protected? So that's a continuing discussion. It's a very, very interesting field, yeah.
That truly does sound interesting and very impressive. So best of luck. Based on your experience so far in the industry, what is a piece of advice that you would give to someone who wants to get into the health industry?
Well, I mean, not just the health industry, but in any industry, you should have a passion for what you do, right? I mean, in our industry, there is a noble element to all of this in terms of, you're bettering people's lives, you're affecting people's lives, and not just the individual, but that individual is part of a family. So there is a wider element to what we do. So that's the nobility of what we do. And if you like to support, care for others, etc., then you should have a passion for that. Now, science is important, and working in that field, really, you should love to challenge yourselves. You should know what your strengths are and your challenge areas and work on them. You should love to work with people, and gain the knowledge and upskill yourself, and then create business. And that's the passion that everybody should have to working within the pharmaceuticals industry. It's been a blessing so far, and I hope that people, can resonate with some of these elements and move forward. And it's very important to mix with a wider set of people. And, Conference 2.0, Healthcare 2.0 is tremendous because you have a number of diverse disciplines and people with different backgrounds, and then sharing the knowledge and having that conversation, it can only make things better.
That's for sure. Have you been able to network with any of the people here and connect with them?
Yeah, absolutely. I mean, there's been, a few things that have been very, very interesting. You have a number of different entrepreneurs and business setups where people are inspiring different technologies that may benefit, the patients and the healthcare system. And there's been tremendous conversations around that. Looking also at different therapies. People have been introducing different lines of therapy for the well-being of every individual. That's been extremely, enlightening on my behalf. Yes, definitely.
So if anyone from the audience would like to get in touch with you for collaboration or advice, where can they find you?
Well, it's very easy. LinkedIn. Now everybody is on the media, right? So LinkedIn, you just punch in Amr El-Neklawy. You'll find me popping up, and happy to hear from everyone.
Perfect. Thank you so much, Mr. Amr, and congratulations again.
Thank you very much. It's been a pleasure. Thank you.